Hello? Is this thing on? Apparently so. Let's check. Okay. It is on. Okay. Good evening. This is Dr. Garais, MED110, A&P1, and want to review the box with you guys. And the box is really neat because it goes through several things. It can go through a little bit of external anatomy of the heart, definitely internal anatomy, and also it goes also through the cardiac cycle. And again, for review, the cardiac cycle is the trace of a single drop of blood from the left atrium all the way through the cycle, through the systemic cycle, through the pulmonary cycle, and all the way back to the left atrium. So first we have to always talk about conventions. Conventions are some of the rules of the land and how we're going to do stuff. Okay, I just want to make sure we're good. Okay, good. So the first convention is we got to know our right from our left. Remember, we always look at the perspective of our patient. So if we're looking here, my patient's heart, this is their left side, this is their right. And the next convention is anything that's oxygenated will be colored in red. As you can see here, everything on this side of the diagram will be labeled in red, and you see this red blood cell is carrying O2 oxygen. Okay? That's our fuel. And then everything on the right side, right over here, is colored in blue, and the majority of the gases on the blue side, the red blood cell will be carrying carbon dioxide. So we're breathing in, we want oxygen, and then when we use it all up, we want to get rid of the waste, and the waste product is carbon dioxide. And that's what we're getting rid of. Okay? So let's look at the box. When we look at the heart, diagrammatically, it's essentially a box. It's a box with 4 chambers, also known as atria and ventricles. Okay. Separate out the box. Okay. Now you go home. If you can practice this by yourself and drawing this by yourself, it will give you a diagrammatic representation of something that's relatively much more complex. But when you really think about it, it's not that difficult if you do it a couple times. So, all the little rooms on the top, they don't have any doors to it. They're just like hallways and they go right through. These are your low pressure chambers. This is your atria. Of course, this is your left atrium and this is your right atrium. And since that's on the left side, I'm going to label it in red. And that's the left atrium. And on the right, that's the right atrium. And then the 2 larger rooms or chambers, you have your ventricles. Left ventricle, and I wrote it in red because it is on the left side of this diagram, and the right ventricle. And I wrote it since it's on the right side of this diagram, right side of my patient's heart. So right now, you can answer some really neat questions regarding oxygenation or deoxygenation. I could ask you, right atrium, is it oxygenated or deoxygenated? And it is in blue, so therefore it is. And if you answered deoxygenated, you would be correct. It's blue and carbon dioxide. How about the left ventricle? Is it inferior or superior to the left atrium? It is inferior. So you could see, you could be asked and answer physiology questions and anatomy questions. Okay, so now that we've drawn out the box, and also do not forget that the box is separated into right and left by a septum. And the septum in between the two ventricles is the interventricular septum. Remember that prefix from your medical terminology. Inter means between. Okay, and you can see there's not supposed to be any communication between the right side and the left side. So the septum keeps everything separated, because everything on the left side of this diagram has to be oxygenated. Everything on the right side has to be deoxygenated. Everything on the left side contains red blood cells that contain the majority of the gases in these red blood cells are oxygenated. And the majority of the red blood cells on the right side of this diagram is deoxygenated, or it has carbon dioxide. So let's begin with the cardiac cycle. We start the cardiac cycle at the left atrium. Okay? Now remember, in a cycle, it only goes one way. So the blood is going to only go one way. The blood can't go back up. And remember when we talked about arteries and veins? The veins have valves to make sure that the blood only goes one way. And the arteries have pressure to make sure the blood only goes one way. So from the left atrium to the left ventricle, we go through two doors. If there's two doors, then it's got to be a bicuspid valve. Since it's a bicuspid valve, there's also two names for it, also known as a mitral valve. Any of these valves that are here or here are AV valves, atrioventricular valves. That means these are the valves or doors in between the atrium and the ventricle. And remember, only goes one way. After it goes through the left ventricle, it goes through a semilunar valve. I'm going to draw it like this. And we saw a picture why it looks like a semilunar valve, because it looks like kind of like a half moon. So if I have one semilunar valve on this side, I gotta have one on this side. And remember, this is purely diagrammatic. I am not an artist here, but we have to look at things simply. Now, this oxygenated blood from the left atrium to the left ventricle goes through the bicuspid and mitral valve, through the semilunar valve, into the largest artery in your body, called your aorta. Remember, arteries take blood away from the heart. So if it goes to the aorta, again, colored red, it has to be the aortic semilunar valve. And what side are we on? We're still on the left side. What side does the aorta have to come out of on the real heart? It's got to come out on the left side. Now, after it goes to the aorta, it goes to the rest of the body. Also known as your systemic circulation. Okay. Systemic circulation, rest of the body. Now, what happens when we go to the rest of the body? I give oxygen to all my organs, and what do? They take it in, they use it up like fuel, and what do they kick out? They kick out carbon dioxide. So when they come back, so just imagine up and out, cross your heart, and comes back into two vessels. One vessel comes from your head, that has all the deoxygenated blood going to your superior vena cava. And then everywhere else, your trunk of your body, goes to your inferior vena cava, and then just rolls right into your right atrium. Because you remember, your right atrium does not have any significant pressure, unlike your right ventricle. Now, after the right atrium, blood goes one way, it falls down into here. Well, not falls, it gets pushed. And it goes through, if this was 2 doors on the left side, this has to be, how many doors? 3 doors. If there's 3 doors, 1, 2, 3, that's got to be called your tricuspid AV valve. Tricuspid. To your right ventricle, it goes out through a semilunar valve into, remember, we're going away from our heart, so that's got to be your pulmonary artery. So if that's my pulmonary artery, because I got to go back to my lungs, okay? What kind of semilunar valve is this? It has to be the pulmonic or pulmonary semilunar valve. Again, once I go out of here, cross your heart, up and over. When we go into my lungs, I have deoxygenated blood. So what do? I bring that to the lungs, and what are my lungs are doing? They breathe in oxygen. Gas exchange. So from my lungs, I pick up oxygen, and now I'm back on the left side of my diagram. And then I'm going back towards the heart, so this has to be a vein. So these lungs are bringing back oxygenated blood to my pulmonary vein. And from my pulmonary vein, back to where we started, in my left atrium. Okay? Now, what kind of questions can I ask you? I can ask you we already talked about the deoxygenated, oxygenated question. That's easy. I can also ask you, what are your AV valves? The AV valve, atrioventricular valve, on the right side would be your tricuspid. The AV valve, AV, atrioventricular, on the left side would be my bicuspid, also known as my mitral. Beautiful A and B question right here. I could ask you, semilunar valves. Semilunar valves empty out from the ventricles. On the right side, it's blue. So it has to be the pulmonic, because we got to go back to the lungs, and we have to go pick up oxygen. And on the left side, it has to be aorta, the largest artery in your body, into your systemic. Another cool question I could ask you, where does all the deoxygenated blood from your head go to? It goes to your superior vena cava. Where does all the deoxygenated blood from your trunk, which is like your head on down, where does that go? It goes into your inferior vena cava. And where does it empty? Right atrium. Does the right atrium or the left atrium have any valves or any doors? Nope, it just falls right in. But the right ventricle, they empty out into the pulmonic semilunar valve. The left ventricle empties out into the aortic semilunar valve. Now, this is also the other really neat thing. You have also identification pictures that you're responsible for this midterm, which also includes the great vessels, which are superior vena cava, inferior vena cava, pulmonary vein, pulmonary artery, and the aorta, or the aortic arch. Now, you can see this diagrammatically. In the real heart, all the vessels come out of the base. Let me go get a heart. Bear with me one moment. Okay, I am back. This is a heart. It's so new, we didn't even take out the... So if you see here, this is the anterior interventricular sulcus. This is the apex, and this is the base. If you see here that all the great vessels, the ones that I just described there a moment ago, they empty out on the top. So how can you tell which one is which? Well, when you're looking at this, if you're looking at the external, you could see that all the stuff is color-coded. So the red, if you look at this red, okay, see this? And it's coming right out and going to the back. Any structure that's on the bottom of this diagram, you fold it back, and that's a posterior structure. So if you look at this, it's going up and to the back. That's a posterior structure. That's the aorta. It's coming here from the left ventricle. And you see here, this is another structure that's going to the back, right? And you see it here. It's blue, coming from your, see this, blue? And it's coming from your right ventricle. So this has to be the pulmonary artery. And you'll know in the back. The pulmonary arteries and veins, they have left and right connections to it. Because of course you have a left and right heart. Okay? And then you can see here, here's a nice example. You have these branches here. This is more up front. If you look at it, this is your superior vena cava. And then you've got your inferior one coming down here. Okay? So that's one thing also, if I'm not there by now, you could start looking at and trying to start figuring out on how to look at the diagram. Worst comes to worst, just memorize it for now, and then after the exam, we're going to figure out some ways for you to get it. Okay? And look at the pictures, look at the diagrams. I have on Moodle also some more diagrams. I'm going to take a photo of this right now, and I'm also going to put this also on Moodle. Okay guys, I hope I'm here by now. Good luck, and talk to you soon. Bye.